Patel, tell us the difference between, people ask this often, I have noticed, the doctor says, we can fix this cosmetic problem, we can make your teeth nicer, better, whatever it may be, more beautiful, more white, more this, more that, with Lumineers or with veneers. What's the difference? There's these two terminologies out there which most of us do not understand.
No, absolutely. The terminology, an analogy to what you're asking me is, look, hey, can you go get me a Coke? And I would answer, well, would you like, or a cola? I would answer, hey, do you want a Coca-Cola or would you like a Pepsi? So that's kind of the analogy which we speak of here right now. A veneer is traditionally a thin shell of porcelain that is placed on the front portion of the patient's tooth or multiple teeth to creating a smile. It is made up of porcelain, and we have the ability of making this into any shape, size, color that patients wish to have it. Back in the early 2000s, a lab which is called Serenade Dental Labs came out with their version of a veneer, which is ultra thin, requires less reduction of tooth structure, and they branded it as a Lumineer. So a Lumineer is basically just an ultra thin veneer, and that's simply where we are with that. I
got it. That's the Lumineer, which is apparently thinner. So basically, we have a fingernail clip on. We clip a fingernail on it. Mm-hmm. I mean, we make that any color, size, shape we want, and that's wonderful. So for whatever reason that one might want to have a different smile. Now, a Lumineer and a veneer, it being thinner, are there any advantages and or disadvantages, pros and cons? Can you explain them?
No, absolutely. There's a lot more that we can do with traditional veneers than we can do with Lumineers. In the early 2000s, we were one of the largest dental practices, a single dental practice that fabricated Lumineers. And I'll tell you this, there are limitations to the thinner materials. You have the limitation of transparency. The thinner the material gets, the more you have the tendency of your natural tooth color showing through that thin material. Whereas with the thicker materials, which is your traditional veneers, you don't have certain issues of that nature. Now, placed side by side, they can look exactly alike. Patients would never notice the difference between a Lumineer and a veneer. They're both very superior products. One of the biggest disadvantages that a Lumineer has, being that it's of a thinner nature, it will have more of a tendency to potentially fracture or chip or things of that nature. And henceforth, the value of that Lumineer is still there in the market, but dentists would more lean towards a traditional veneer than a Lumineer in this day and age.
I see. Okay. Wonderful. Of course, the fact that if you have to grind the tooth down a little bit less, that in itself is probably some type of advantage also, right?
You're absolutely correct. Our goal, we know in dentistry, whenever we put a drill to a tooth, that at some point down the road, we are proning the patient to some form of caries. Now, when that is, we do not know. Maintenance has a lot to do with it. Home care, but no, you're absolutely correct. If a 20-year-old were to walk into the dental practice, we'd well, at any age, one of the biggest things that we would like to do is conserve as much of healthy tooth structure as possible and not just cut it for the sake of cutting it. So in that conservation process, a Lumineer has a much, much larger advantage than a traditional veneer or a crown in cosmetic dentistry. Absolutely.
But in any case, Lumineer or veneer, if a person really needs a more beautiful smile for whatever, that next wedding, that next huge business meeting, whatever it may be, within days he can look 100% different, right? You can have a Julia Robertson, Tom Cruise type of smile, even if before he looked rather ugly.
No, you're absolutely right. We're in the business of satisfying patients, giving them exactly what they need in a timely fashion. We have fabricated Lumineer. I'm sorry, I apologize. We have fabricated traditional veneers, which are absolutely beautiful within 24 hours, and it takes all the way up to 2 weeks time in just 2 appointments. So it can be done very quickly. They're both very good products. It's just a matter of what fits the patient's need. The bite has a lot to do with it. The ability that the patient chewing certain foods has a lot to do with it. So it's a process of sitting down and basically understanding, A, why the patient needs it, and B, how the patient is going to utilize it moving forward.
And I heard that, you can literally, I suppose, computer image or whatever this is called these days, you can show the patient and say, look, if we make your teeth just a little wider or a little smaller, whatever the case may be, a little shorter, a little longer, change the color a little more, here's what's happening. It fits you better. Especially if one already starts in that direction, maybe because of a couple, 2, 3 real big chipped teeth for whatever reason, accident or so, then you go, okay, why don't we do all of it? Or because a person wants to just change, or because a person had several crooked teeth but doesn't want to wear braces for 2 years, and then he can, use the veneers / Lumineer to fix that, and at the same time adjust the total look of size and color and everything, and adjust it more towards his face. Is that correct? And he can really participate in it. He can see it. He can say, almost like a car, yeah, I like that color better, or I like those seats in it, I like that color better. He can participate in that type of thing. The technology has gone that far. Is that true?
No, you're absolutely correct. These products are very strong. They are, like I mentioned earlier, they could be fabricated in any shape, any size, any color that the patient needs to or wishes to enhance their smile with. So the first steps that we usually take here at Alpha Dental Excellence is, number one, we will take a picture of the patient. There are 2 ways of at least showing the patient what the final results could look like. Way number 1 is a computer enhanced image of their before and after. And way number 2 is we send models to the lab and have the lab physically wax up the teeth with white wax so that the patient can see what the alignment of the teeth are going to look, the shape and the size of that. But no, you're absolutely right in the sense that the patient has full control of what shape, size, color that the patient would like to have in their mouth. I understand one thing, and I instill this in all of my doctors and staff here at the practice, and that is, look, at the end of the day, the patient has to look in the mirror every day, not you, not myself. So we cater to the patient's needs in making it exactly the way the patient wants. Now, there are aesthetic guidelines that we share with the patients that we try and abide by the guidelines so that we can give the patient the most aesthetic looking smile that we can.
Why? Because you dentists, especially the ones who have specialized in that, you're trained in that. It's a little bit like a fashion designer. I go and I see 200 guys and 200 shirts, and I don't know which one goes with another one. Now, the fashion designer might give me 2, 3, or 4 choices, the right salesperson in the store, since I don't go to fashion designers. But there you go. But from there, I kind of then narrow it. But he guides me in the right direction already, because otherwise I would fit, things which I come home and my wife says, "What did you do?"
No, you're right. The beginning point in selecting a smile is always looking at the shape of their natural teeth. This is a God-given shape. It is something that was meant to be in their mouth. So we start with that basic shape. And we have catalogs and catalogs that we sit down and guide the patients through as to how they would like to modify that or change that. Now, that being said, I always encourage my patients, that, hey, look, if you're going through a magazine and if there's a smile that you like, you had mentioned Julia Roberts earlier, she's got a gorgeous smile. And if patients like her smile, I would urge them to bring that picture in. That way we can go ahead and come as close to that smile as possible. But once we've selected the basic shape of the teeth, we will then go ahead and start selecting color. And there's a big science behind color. Yes, everyone wants white teeth, but you know, there's two types of color that we sit down and go through patients. You could have monochromatic teeth, which is one color from top to bottom, where you could get into polychromatic teeth. Polychromatic teeth obviously are just much more natural than monochromatic teeth. And then we just move from there into the edges of the teeth and the gum line and things of that nature to creating the smile that they're looking for.
Wonderful. Thank you very much, Dr. Patel.
All right. Thank you.